How do doctors handle patients who are uneasy or flat out refuse a rectal exam? When I was a practicing GP, we'd recommend prostate exams starting at 40 for men, or earlier if there was family history or symptoms. It's a standard screening for prostate cancer, which kills about 34,000 men annually in the US alone, per CDC data. But the exam, digital rectal exam, DRE, is awkward, invasive, and a hard sell for many. Here's how it's approached, with a fresh take inspired by your story. Take a patient like Mark, hitting 40, in for a routine physical. You mention the prostate exam, and he freezes, maybe cracks a nervous joke like, "Doc, anything but that." Some shut down entirely, saying, "No way, not happening." The goal isn't to force compliance, but to bridge the gap between discomfort and necessity. First, you acknowledge the awkwardness. Humor works wonders here. I'd say something like, "Trust me, this isn't my idea of a fun morning either, but it's quicker than a handshake and could save your life." It's a nod to their unease while keeping it light, like your pit stop line disarmed Mark. Next, you build trust with clear, no BS communication. Explain why it matters. "This exam lets me feel for anything off with your prostate, lumps, enlargement. That could mean cancer. Catching it early is a game changer." I'd share stats, like how 1 in 8 men face prostate cancer. But early detection via DRE and PSA tests boosts survival rates to near 98%. If they're still hesitant, you explore their fears: embarrassment, pain, cultural taboos, or past trauma. Some guys worry it'll hurt. It's usually just brief discomfort. Others think it's unmanly. Listening without judgment is key. If they refuse, you don't push. Forcing it breaks trust and makes future visits less likely. Instead, offer alternatives. We can start with a PSA blood test to check your prostate health or discuss symptoms first. PSA isn't as comprehensive alone. DRE catches things blood tests miss, but it's a step. You also suggest they think it over and revisit it next time, ensuring they feel in control. For extreme cases, like a patient with trauma, you might refer them to a specialist or counselor to ease them into care. Your story nails the human side. Mark's bear wrestling quip and your quick-witted reply show how rapport turns resistance into cooperation. Data backs this. A 2019 study in family medicine found patients were 40% more likely to agree to DREs when doctors used empathetic communication and clear explanations. It's never about strong-arming. It's about making them feel safe, heard, and empowered, even when the task is unglamorous. Ever had a doctor win you over for an awkward procedure? What worked?